Today we heard from Governor Ducey for the first time publicly in 5 days since that town hall meeting last Thursday. He unveiled 4 new executive orders. Among them, staff and at residential and nursing care facilities must now wear appropriate gear, check for symptoms of patients, and offer electronic communication if visitation is restricted. Another order expands healthcare reporting requirements from hospitals and providers to better track the spread and determine where help is needed. Finally, out-of-town travelers from certain areas now required to self-isolate or quarantine for 2 weeks. ABC 15's Nicole Gregg has been following the latest development, and we're talking about specific states where travelers may be coming from. Nicole, what can you tell us about it?
That's right, Steve. We're talking passengers from 3 different states, Connecticut, New York, and New Jersey. When those passengers arrive, they will have to self-quarantine for 14 days. But here's the thing, there's really no plan for enforcement or how this will take place. The governor basically saying that he's asking people to follow this order. Another executive order coming down, hospitals will now have to report more data to the state, including numbers. How many COVID-19 patients are in ICU? How many are suspected or positive as well? And for the number of ventilators in use for positive cases. One thing we have been pushing for is information by city or zip codes, and we're learning that leaders are hearing our questions. They're being heard. They will start releasing data by primary care areas, but we're still trying to figure out if that means zip codes or what type of areas this will include. One question no one wants to answer is, what are the best and worst case models? I've been asking the governor, shut down this question last time I asked him about worst case scenarios. He does not like this question about projections on cases or the projection on deaths.
I'll close with a prediction for you, though. We're 1 day closer to this being behind us. April is going to be a difficult month, and the expectation is that we're going to have the maximum amount of hospitalizations in May. We're going to do everything we can between now and then, and you all have been seeing me every day or several times a week, and certainly more than often. We're going to continue to over-communicate. When I know something, you'll know something. We'll be posting it on the website and continue to be transparent. Thank you. Thanks, everybody.
So you can see the governor stopping the press conference there. He did not want to answer that question once again. Another thing we're learning, the state is not tracking the number of positive cases within hospitals, so the number of healthcare workers. We asked them today, how would they know if there is a problem in the healthcare system if they are not tracking this data? Also, I asked if healthcare workers are safe, because there's not enough protective equipment for these healthcare workers. They also did not answer that as well. We're live in Phoenix. Nicole Gregg, ABC 15, Arizona.